Anita is going to demonstrate the proper technique to change the dressing on a peripherally inserted central catheter line or PICC line. Anita is checking her orders and has obtained a dressing change kit and supplies and will now prepare the patient and the room for the procedure. PICC line dressings should be changed every 24 to 48 hours if a gauze dressing is used, every 7 days if a transparent dressing is used with a biopatch, or if needed, if soiled, loose, or moist. PICC line dressing changes require standard and transmission-based precautions, so turn off any fans, close any open windows, and ask the patient to turn their head away from the site or provide the patient with a mask. Anita is now ready to remove the old dressing. She's going to put on her mask and clean gloves. Using an alcohol swab, she's going to loosen the edge of the transparent dressing to make it easier to remove. And she's going to remove the dressing from the bottom working upwards to prevent dislodging the catheter. And to discard the old dressing, she's going to inspect the site for any bleeding, redness, drainage, or edema. She's going to now remove her gloves and perform hand hygiene. She's now ready to get ready for the new dressing. She's going to open her kit and establish her sterile field. She's going to put on her sterile gloves. Okay, she's going to secure the catheter with sterile gauze and clean the site for 30 seconds with ChloraPrep. And the last thing she's going to do is clean the tubing from the insertion site to the distal end. She's going to let that air dry, and she's going to apply the biopatch, blue side up, making sure that the catheter is in the slit part so that it won't dislodge the catheter when it's being removed. When dry, she's going to apply the Tegaderm. Next, she'll label with her initials, the date of the change, and when the next change will be due, and she's going to apply that to the Tegaderm. She's going to now ensure that the catheter is clamped, and she's going to remove the injection caps and replace them with new ones. Okay, she's all finished. She's going to remove her gloves and her mask. And she's made sure the patient is in the low position. She'll make sure that he has the call light within reach. She'll check with the patient, make sure he's doing fine, and she will go and eventually document the procedure.